Hello, my name is Caitlin Day, and I am currently a dental hygiene student at Vermont Tech. Today I'm here to talk to you about implementing the role of dental therapists in the state of Vermont. Today on our agenda, we're going to be talking about the dentist shortage, which leaves patients without dental insurance, forces Medicaid patients to go without care, forces people to forfeit their appearance, and leaves many wondering what will happen when the majority of our current dentists retire. We'll be talking about our solution to that, which is the dental therapist, our project budget, our conclusion, and finally a question and answer at the end. There are many personnel required for quality patient care that many don't think of. There is the dentist, dental therapist, dental hygienist, dental assistant, and the dental lab tech. The dental therapist is important for patients to receive the best quality care possible. Dental hygienists do as much as they legally can do while working for a dentist. However, there are just too many limitations in what hygienists can do that won't allow for a change in Vermont's dental care. The current dental shortage is a problem for the people of Vermont. Some of those issues are people don't have enough money for dental insurance or dental care, people on Medicaid are accepted sparingly, people are unhappy with their appearance, and of the dentists that are here, many are of the older generation and can retire soon. Many people in the state of Vermont can't afford dental insurance. Patients without dental insurance, even the littlest procedures become very pricey. For people who have to choose between, say, fixing a tooth that's been bothering them and supporting their family, many decide that dental care just isn't worth it. According to Bernie Sanders, in Vermont in 2009, 62,000 adults ages 18 to 64 and 10,000 seniors went without dental care because they just couldn't afford it. There's also Medicaid patients. Traditional Medicare doesn't offer dental benefits, but some Medicaid patients have the option for dental benefits. But these dental benefits have limits, usually only covering emergency dental care. And only about 20% of the nation's practicing dentists provide care to people with Medicaid, and of those who do, only a small percentage devote a substantial part of their practice to serving those Medicaid patients. And of course, appearance matters to everybody. One of the most important things in life is to feel good about yourself. Untreated dental problems result in missed work and school, poor nutrition, and a decline in overall wellness. Untreated dental problems lead to decay, periodontal diseases, and ultimately the loss of teeth. Patients missing teeth are also more likely to be depressed and are then more likely to lose more of their teeth through neglect of oral hygiene. Without enough dentists to do restorative work, many people are just left unhappy and unsatisfied about their smile and themselves. Many current dentists in Vermont are at the age or financial stability they need to retire. In a survey taken in 2003 by Vermont state officials, they found that 53% of dentists plan to retire within 10 years. With over 23 dentist shortage areas in Vermont, including but not limited to Washington County, Caledonia County, Orange County, Rutland County, it seems to be that there are just more dentists retiring than there are graduating. The solution to that will be creating the role of the dental therapist. Dental therapists won't need direct supervision of a dentist and will be allowed to perform many of the same tasks that dentists do, including taking radiographs, placement of temporary restorations, tooth reimplantation, administration of local anesthetics, and also cavity preparation, extractions of primary teeth, pulpotomies on primary teeth, and restoration of both permanent and primary teeth. In 2009, it was found that 830,000 visits to emergency rooms around the country could have been prevented if the patients had seen a dentist earlier, and in 2011, more than half of the children on Medicare went without dental care. The dental hygienist will improve the oral health care for patients. More patients will be seen because there will be more personnel. More time can be spent on each patient, which really customizes their care plan, and we'll also see an increase in Medicaid patients because we won't need to single patients out based on their money. We'll be able to accept whoever, whenever they can come. Of course, there is some schooling for dental therapy. The dental therapist programs are 3 years in length and can result on any degree level. It could be an associate's, a bachelor's, or a master's level program. There is a granting of an accelerated educational pathway for people who are already hygienists and dental assistants so that they can also become dental therapists. To be a regular dental therapist, you need to graduate from a dental therapy educational program that has been approved by the Board of Dentistry, pass a comprehensive competency-based clinical examination, and also pass an examination on laws relating to the practice of dentistry. There's also the ability to be an advanced dental therapist. To be an advanced dental therapist, you will need to complete the requirements of the regular dental therapist, plus earn 2,000 extra additional hours hands-on experience, submit 3 to 5 patient records, and successfully complete a computer-based examination. We have our budget estimated at $282,000. We imagine that supplies will cost around $7,000, which will include the saliva ejectors, gauze, instruments, etc. Equipment, which will be the lab coats, gloves, lights, and chairs for the units, $10,000. Personnel, $250,000, and training time, $15,000. So, as I said, a total of $282,000. As of right now, there are 3 states that have implemented the role of dental therapist in the United States. Those states are Alaska, Minnesota, and Maine, and hopefully soon we'll be seeing the dental therapist in Vermont dental offices. Of those states that have already created the dental therapist, we've seen that at study clinics, many therapists are working part-time and have already served 6,338 new patients. Overall, nearly 1/3 of patients surveyed experienced a reduction in wait times for their appointments since the dental therapist was employed, and some patients saw a reduction in time travel for their appointment, mostly in rural areas. Clinic reports additional impacts of dental therapists, including personal cost savings, increased dental team productivity, and improved patient satisfaction. It's cheaper for a practice to hire a dental therapist than a dentist, so creating a dental therapist will also help out practices who are ready to see more patients without taking on a financial burden. Dental therapists will also be able to start their own practices, so it will help rural areas that they won't have to travel as far because hopefully the dental therapists will be creating more offices in more areas. So in conclusion, the dental therapist will develop a career that will ensure Vermonters a more quality healthcare. That's for patients and people who are looking for a new job. It's got a high paying salary, it's competitive, it's very rewarding to see patients happy, and it's also relieving dentists of their busy schedule, so overall everyone's happy. It's also more efficient, more money will be made because more patients are being seen, and patients will also have a more customized care plan based on their need, which is perfect for everyone. To evaluate how the dental therapist is affecting Vermont, we can create both patient and faculty satisfactory surveys, and we'll also see an increase in job stability and licensures going out. So that was our presentation for today. If anyone has any questions, please feel free to ask.